So our next talk is ALS Care, Professional Counseling and Support at Home from Martin Berger.
Okay. Good morning, and thank you very much for having us here. I have to send you the regards from Martin Burger. He's a president of our association and unfortunately can't be here, so Thomas and I will do our best to replace him and talk about one of our core services, which is called ALS Care.
What do you do?
What do I do?
What do you do?
The green.
The green button. Yes.
Here we go.
Fine, well said. So, as you see, our organization was founded in 2007. We are a very small organization, and it goes back, actually, it was founded by a widow and a patient with ALS directly. So they felt at the time very left alone, anxiety, missing of support, and that's actually what made them say, let's do something to improve the situation for future patients and future relatives. And I think I can say we are still attached to this primary vision to be very close to patients and relatives in supporting them. And we are small and also financed only by private donors and without public or government funds, even though we are based in Switzerland.
Like Thomas said, we have a strong focus on the support and direct help for pals and relatives, and in some cases children, entire families. And one of a part of this is also to educate caretakers, nurses, etc., and to establish a network within Switzerland that to make sure that every person suffering from ALS and person who is related in some way with a person with ALS gets the best care as possible.
And as a second main topic of our organization is, as we heard it before from other organizations too, of course, we try to raise awareness, and we're doing this with classical means by media exposure, social media. I can only dream of these numbers of followers that I've heard before. I figured out on the table whether I even mentioned our social media activities, hearing what is possible elsewhere, but we try. And then we have, of course, participation in Global Day every year in a different city in Switzerland. Actually, we're going to the capital of Switzerland, Bern, and so we're there with an event and raising awareness this way. And then, of course, also very classical, the annual report, which in our case is also, I say, for the last 2-3 years, we started to reform it actually into more also a fundraising and marketing tool with big stories and pictures, people stories. And I have let you, the last example of our work on the table is an interview with Sue Clark that we made recently, who was talking about the loss of her brother David. And this is actually the kind of style we try to reach people that are not aware what ALS is, so that they can be touched about this kind of stories without knowing very much in advance, just to read the story and then go like, wow, that's intense. This is just to give you another example. You see Albert here and Stephanie on a boat trip on our yearly holiday camp, which is very popular and which is also an opportunity for us to bring people together, to give them a good time, and of course also to use this kind of precious moments to have beautiful pictures and stories and fundraising material to afterwards reach people who say, oh, what's that, ALS, never heard of it, and then over this kind of stories we can maybe reach them and let them fund us also.
Those are the logos which represent our major offerings. I go through it real quick. You can see the suitcase, that's for the holiday camp we do every year, which Thomas just mentioned. Then we provide wheelchairs and medical devices for free, particularly for people who don't get any social insurance money. The hand there, that's the direct support, mainly financially. And then the networks we mentioned, one is for professional caretakers and one is for pals and relatives and friends, etc. And then we have ALS Care. That's basically what we're talking about now.
So ALS Care as a main topic, shortly, it's actually all about filling a gap within the treatment chain. And as we all know, and as we heard also today again, is that anxiety, missing of support, being overwhelmed by so much things to do and not knowing which is the next step to take, what makes sense, is actually something we know from all over the world. It's very common to us, but not for those who are confronted for the first time. So it's just like a wave coming over those families. And here we have, with ALS Care, we have actually someone to talk to, someone who comes home, gives actually advice and guidance in a very practical sense, actually, to say how can we decide what is maybe the best step to take.
So what does a care nurse do in a nutshell, quickly? They're called care nurses, but they're actually care managers. And what Thomas already said, it's a moral support, but it's also an incredible important task is to educate people, professional caretakers, but also families, relatives, and caregivers. And it's also something which very often after the diagnosis or even after maybe the disease has progressed or is progressing, people are, at least that's the case many times in Switzerland, feel lost and left alone by doctors, and that's where ALS Care comes in.
So how does it work? What does it need? Actually, those 4 icons would probably say very much, or almost everything, but still. Phone call, contact. Of course, there needs a contact to be established. Important is that ALS Care can be asked directly from patients or family members, but also via nursing homes, hospices, family doctors, and so on. So this program is actually quite open. And then, of course, next step is visit. And here the important point is that the visit is provided wherever the patients with ALS or the family members stay. So that means it could be at the home, in a clinic, in a hospice, wherever it is asked or needed.
We collect data, but we mainly collect data which we evaluate to get closer to the actual needs of pals and caregivers, and that's why. And to improve our services, and we have to hurry up now. No, that's fine. That's perfect. And there we come into action. So let's just conclude the benefits for pals, for family and friends, and for caregivers. Patients and relatives get advice and guidance in a very, very practical sense at home, or maybe in an institution, but preferably at home.
Now me. And then it's also a program for education for healthcare professionals, so that we have both sides actually, directly with patients and relatives, but also educating professionals. And this actually is the last slide. You see Rita, which is on our annual report, one of those interview partners we were allowed to tell her story to the public. Thank you so much.
Any questions? Comments? Remarks? You're behind the column, I can't see.
I didn't quite understand.
You say 250 home visits with 8 nurses? That's what you said?
Yes, roughly. That's what it is. Yes. No, not in 1 week. No. No.
Yes. Let's take. You had another. You need this one, or you have?
I was just wondering, why is there such a gap between, why does this gap exist for the home healthcare? I mean, I sort of think of, I was just wondering, like, what services does the government provide? Any services, or is there any sort of movement to kind of increase the government services so that there is more help for PALS in Switzerland?
It's very much an ALS related issue. I mean, there are always gaps in a chain for provision for people with bad diseases and serious diseases. But in ALS, the problem is that very often people nurses who would come home, they are not educated in ALS. They're not familiar with ALS, and very often they reach their limits too, because they don't really know what's happening. This week, a person can clearly articulate what he needs and what he wants. Maybe next week this is not possible anymore, and there is no official or from government or insurance-based service. That's why it was introduced in 2009 to have this individual service, and we are expanding it and we are improving it. Also, like what I said about the data, that we constantly learn to understand needs better, and we are in close contact with pals like Rita, for instance, who gives us a lot of feedback. Also says that's what we need to do, etc., etc. So that's basically the reason.
Any other questions? Okay, thank you so much. This mic goes back to the